review an abdominal assessment. Now, you may remember from the Intro to Health Assessment video that the order of assessment is a little different with abdominal assessments. You'll see that here in this video as well. We're going to inspect first, but then we're going to auscultate. The thing is, if you start pressing all over the abdomen before you listen, you could actually affect bowel sounds. So let's look at what this actually looks like. So again, as always, we start with inspection. You want to lift your patient's gown and look at their abdomen. You're looking for the shape, the contour, looking for any bulges, masses, or distension. You can even shine a pen light across it if you need to look for differences. You're also looking around the umbilicus for any redness or swelling, any drainage or obvious herniations. You can have the patient cough or bear down to make hernias more apparent. Also make note of any wounds, lesions, or scars and the details of those: size, shape, color, drainage, etc. Make note of any visible pulsations or respiratory movements, just like we did in heart and lungs. Now we can move to auscultation. Again, this is where it's a little bit different. We want to make sure we listen first. Start in the right lower quadrant and work your way up, over, and down, listening for a full minute in each quadrant. You should hear between 5 and 30 clicks a minute. Less is considered hypoactive, more is considered hyperactive. Now, in order to confirm that bowel sounds are really absent, you actually have to listen for a full 5 minutes in each quadrant. Now, while you have your stethoscope on, turn over to the bell of your stethoscope and listen for bruits over the major arteries. You'll listen over the epigastrum for the aorta, up and to the side of the umbilicus on both sides for the renal arteries, and then to both femoral and iliac arteries. Remember, a bruising is a whoosh sound that indicates a narrowing of the arteries, which is never good. Now that you're done with auscultation, you can move on to percussion. You're going to percuss all 4 quadrants, again starting in the right lower quadrant and working your way around. You should hear tympany like a drum. Dullness over the liver or in obese patients is expected, but otherwise dullness could indicate fluid, blood, or a mass. Now we also want to check for CVA tenderness. This could indicate inflammation in the kidneys. Place one hand on the patient's flank and strike it with the ulnar side of your other hand and repeat that on both sides. It should not be painful. Now finish up the abdominal assessment with palpation. Start with light, small circles in all 4 quadrants, or even smaller sections if you want. You're looking for masses or tenderness or guarding. Then you're going to move to deeper circles in the same 4 areas. You want to make sure that you note anything that you find, note its location and its size. If you suspect appendicitis, you can test for rebound tenderness over the right lower quadrant by pressing down slowly, then releasing quickly and asking which hurt more. Now, if you see any distension, you're going to test for ascites. Now, of course, this patient doesn't have any, but we're going to show you the test anyways. Have the patient put their hand over their umbilicus, put one of your hands on one flank, and tap the other flank with your other hand. If you feel the tap in the opposite hand, that's positive for ascites. This is called the fluid wave test. So make sure your patient is covered and comfortable. That's it for the physical portion of the abdominal assessment. Make sure that you're also asking your patient about their bowel movements, assessing their stool, color, frequency, consistency. It's super important, guys. You got to know about their poop. All right. Go out and be your best selves today, guys. And as always, happy nursing.